Right, this is our nurse case management group presentation. This is created by Nathan Alarcio, Leia Beck, Juan Delgado, Francisco Garcia, Janelle Gutierrez, and Margaret Kennedy. So the description of our patient and his chronic illness. The case report we are analyzing today is a patient who is a 56-year-old Caucasian male whose primary diagnosis is paranoid schizophrenia, which he's had for 36 years, and secondary diagnosis of type 2 diabetes. He's had that for 14 years, and psychogenic polydipsia for 3 years. He is under LPS conservatorship, currently homeless, and has no source of income, which qualifies him for Medicare Part A insurance. He has been homeless for 7 years with no social support. He has been admitted to the hospital for a seizure that occurred due to having a sodium level of 117. Due to his inability to adhere to his treatment plan, along with the factors such as homelessness, complex health issues, and lack of support system, nurse case management interventions have been initiated. All right, next one. So clinical judgment comparing self-care capacity with chronic illness and treatment. So the patient is an independent individual who can complete his own ADLs. However, he cannot perform tasks such as shopping, preparing meals, taking his medication, symptom management, household maintenance, and financial management. The patient's inability to prepare his own meals puts him at risk for exacerbations of hyper and hypoglycemia, as well as hyponatremia. Due to his schizophrenia, he is unable to comprehend his disease process and treatments. He has shown incompetence of medication and disease management, as evidenced by him taking half of his haloperidol supply in 1 day. He exhibits strong delusions that he is not diabetic and the insulin he is taking is actually estrogen. He requires regular blood glucose checking and has shown incompetence in both glucose checking as well as insulin administration. Next.
Okay, so the priority patient issues for discharge planning for this patient, one would be with Medi-Cal enrollment. I know the Medi-Cal pays for inpatient coverage for all the outpatient care he's going to get. He would qualify for Medi-Cal due to his diagnosis of paranoid schizophrenia, and he's at poverty level with no income. The nurse case manager will need to assist with ensuring that he's enrolled. Also to collaborate with the multidisciplinary team. That would include social work, the assigned and the psychiatric liaison team to coordinate placement in a long-term psychiatric facility. Next slide. So for clinical judgment, where the patient can be discharged, it looks like he needs a long-term care. He qualifies gravely disabled, which is defined as a condition in which a person, as a result of mental health disorder, is unable to provide for his or her basic personal needs, food, clothing, shelter. And then according to Powell and Tahan, long-term care is placement for persons with functional disability, including chronic medical, mental health, social problems who are unable to care for. So this patient has repeat hospital related to the inability to manage his chronic medical conditions, and he is dependent with his instrumental activity of daily living. Next slide.
Okay, so the priority nursing case management strategy at the patient level would be to monitor the patient's physiological stability. To monitor his physiological stability, the nurse case manager will ensure proper monitoring of the patient's medication compliance, blood sugar checks, appropriate insulin administration, nutrition intake, and patient's exercise level. The priority nursing case management strategy at the system level is to plan and coordinate the patient's ongoing care with the healthcare team. Communication regarding medications is important because of the patient's history of being non-compliant with medications in the past. Discharge planning is also very important for this patient, and identifying and securing the appropriate facility that best meets the patient's needs is crucial for his ongoing care needs. This intervention for the patient level nurse case management strategy is to monitor the patient with continuous one-to-one care. The patient requires continuous one-to-one care at this time due to his lack of insight into his illness. The patient's poor judgment and safety awareness make him a danger to himself. The patient requires medication management as well as medication administration due to his inability to manage his medications. The patient's noncompliance with his diet is another reason he needs to be monitored. The patient's inability to acknowledge the fact that he cannot have a certain amount of water due to the effects poses a risk, and therefore his water intake as well as nutrition intake need to be monitored. His ability to state an exercise plan to manage his diabetes, along with his diet, are another reason he should be monitored. The patient needs to continue to be active so that further progression of his diabetes and the effects on other organ systems can be prevented. The patient has been deemed gravely disabled. Gravely disabled by California definition means a person cannot provide for their food, clothing, or shelter. In addition, if the person is non-compliant with treatment and medication, this helps to build a case for the LPS conservatorship.
For team communication, a care manager would collect relevant information about the patient's health status and how he is progressing with the plan of care. The care manager would share that information with the treatment team during interdisciplinary huddles to bring attention to any issues that may impede the patient's progression towards an improved level of health and discharge. Transitioning a patient from one setting to another always carries a degree of risk, as the next facility will not be completely familiar with the patient's unique needs. Therefore, open communication to the best of all the team's abilities is essential to prevent a decline in health status or disease exacerbation. Given the patient's history of noncompliance with treatment plans and medication regimens in the past, the most appropriate intervention is referral. Refer various specialties to the patient's case to provide the best possible care. Next. The patient's case requires open team communication, advocacy for the patient given his inability to do so due to his longstanding psychiatric condition, and planning and coordinating to help him transition through the healthcare system as smoothly as possible. Given the patient's living situation, which includes unemployment, homelessness, and chronic mental illness, he is covered under Medicare. A utilization review would reveal that given the patient's comorbidities, he would be a difficult patient to place, and thus would be an outlier case due to his extended stay as an inpatient. The patient's needs should be identified as soon as possible to avoid decompensation in health status and avoidable complications. The patient's level of needed care would be assessed so that he gets placed in the proper unit. Timeliness of discharge is important in order to minimize the number of avoidable days. Next.
Quality and safety issues. The 6 aims of healthcare delivery include safety, effectiveness, patient-centered care, timeliness, efficiency, and equity. Patient engagement includes the knowledge, the skills, the ability, and the willingness to manage diabetes and schizophrenia. Access to involvement with care as well. Care coordination includes long-term care placement, outpatient resources, home health and supplies such as durable medical equipment, glucometer, and testing strips, evidence-based care and practices being applied to diabetes and mental health, including schizophrenia, clear clinician communication and cooperation among specialists, inpatient and outpatient. Lassen states, patients who are actively involved in their health and health care tend to have better outcomes and lower costs compared to individuals who are not actively involved in their health care. Next slide. The nursing case manager effectiveness at the patient level includes increased self-care abilities and self-management of disease, medication management and administration, including insulin and haloperidol, monitoring of blood glucose and intervention when necessary, blood glucose control, participation in a diabetic diet, moderate exercise, fluid restriction, reduction in emergency room visits, and participation and compliance with psychiatric and endocrinology care and health.
Now, when it comes to nurse case management effectiveness at a system level, we have diabetic education, and the need for diabetic education is to manage his own insulin and also glucose checks. Additionally, we have a long-term psych facility placement, and mainly this is due for the fact that he is gravely disabled, unable to take care of himself, and the fact that he's high risk for readmission due to his repeated hospital admissions in the past, which at this point is the safest and best option for this patient, which really just highlights the importance of medication adjustments and verifying the insurance are covering those medications as well. Now, when it comes to psych consultation, that's is the reason why it's highlighted the importance of having one. It's to manage his medication dosage and the effectiveness of such medication as well. If the hospital, during his hospital stay, right before he decides to be transferred over, or he's able to go to the psych facility for long-term placement, he will benefit from spiritual support. At this point, spiritual support in the hospital can help someone by talking about their problems in the situation. And also spiritual support is not just about religion. Then we could also have the use of a cognitive behavioral therapy. This kind of helps out in regards to an overall attempt to encourage independence and management of this psychological chronic disease issue. And lastly, the use of a county behavioral health visit. And the reason for this is not only can they come up with a different plan, or at any point where they feel like this patient has done excellent and he has turned himself around, they could also manage in keeping up with a possible plan of leaving the long-term facility if possible. Next. And these are our references from our PowerPoint. Thank you for listening.